Hi guys. So I just wrote this blog about pregnancy and Nail-Patella syndrome. So you probably already read, hopefully, the stuff above in regard to any sort of medical condition that might come along with Nail-Patella syndrome in pregnancy. So go to your physician for that. Not me, but in regards to specifically like back pain, I'll talk with you a little bit more about that here. So as I kind of discussed previously, and as many of us know, with Nail-Patella syndrome, we tend to have a lot more curvature of the spine, so in the lower back area. So what that can do, which I will write about this more later also, is just kind of add a little bit more stress on your back and potentially more back pain, just depending on how you're coping with it and, what your lifestyle is like and that kind of thing. So with pregnancy itself, with people that don't have Nail-Patella syndrome, you have, you're adding extra weight to the front of your body. So your body is starting to curve. So it's adding that extra curvature that we already have with Nail-Patella syndrome. Most of us do. So you're kind of getting more back pain in the pregnancy. So if you add that to someone who already has that extra lordosis and extra curvature of the low back, you obviously are at a higher risk of getting more low back pain. So just thinking of some ways to deal with that, as you probably read above, and you'll see a little bit more here. It's different with everyone. So if you don't have any back pain and you're pregnant, awesome. If you do, hopefully this helps. Just a little snippet on back pain though. So a lot of times we will treat back pain. There are many different ways to treat it as a physical therapist. So there's not one way. So the exercises I'm going to show you, hopefully they'll help. Some of them may help, some of them may hurt. Again, this is just a very general exercise program. I definitely recommend trying to find someone near you. So a lot of times we'll have flexion versus extension based exercises. So flexion based are the ones where you're kind of bending over or almost curling up this way. So flexion is more this direction. Extension based would be more extending your back this direction. Okay, so flexion's coming this way, extension's coming this way. So those are generally the two types of exercises that we kind of use to treat back pain. Now there are many others too, so it's a lot of core stabilizing and flexion versus extension, and usually people are either one or the other, flexion or extension based. But again, it's a mix. It's usually based on your lifestyle and what you do, and what else is going on with you. So some other tips before I go into the exercises would be to find a women's health therapist near you. So there are actually physical therapists that specialize in women's health. So, we get a general overview of it in PT school, but there are people that really this is what they do every single day and they love it. And they've seen so many different people that are pregnant and, so many issues, even if you're not pregnant, women's health issues, and that's what they specialize in. So I recommend seeking someone out that specializes in that, just because it will likely be, hopefully better for you. And other things they might recommend too are wearing a belt, whether it's an SI joint belt or a maternity belt or something to kind of support that front area. And as we know and we've read, your ligaments really kind of loosen up when you're pregnant. So, wearing something like a belt to kind of pull it all back together, that can really help decrease the back pain. And, getting involved in yoga or some other sort of stretching program or maybe even aquatics. It just kind of depends on, if you're pregnant, if you're not, what stage of pregnancy you're at, and that kind of thing, just kind of what you're used to. So let me, again, kind of describe that lordosis. So what happens, so this is me normally, so I do have a little extra lumbar lordosis here. It's normal for everyone to have some lordosis and some curvature of the spine, but again, with Nail-Patella syndrome, we're likely to have more curvature there. So as you're adding more weight and, I'm trying to push my belly out here, becoming pregnant there, you're kind of pulling yourself this way. So your body, you can even see it. If I kind of go, it wants to curve and adjust and adapt. So you're giving yourself more curvature of that spine. And again, your body is very smart and it wants to make sure that you are a fully functioning human. So it's going to adapt and change to keep you functioning. So that's why it kind of curves like that. So gravity and your stomach is pulling yourself forward and kind of anteriorly, so your back is adjusting based on that new weight in front of you. So I will get to the exercises below.